Mr. Rasmussen. My name is Carrie. I'm an OTD student. I'm going to be working with you today.
Okay.
Would you prefer Paul or?
Paul's fine.
Paul? Okay, cool. So what we're going to do today is a little work on your feet. I hope you got your pedicure because you're going to have to take those shoes off. We're going to work on inversion and eversion. And that ties my hands.
Okay. Grab the shoes.
Alright. So the first thing we're going to do is I'm going to use this tool called a goniometer.
Okay.
And this is going to give me, it looks like a protractor. So it kind of measures the angles and it's going to let me keep a baseline and follow your motions and your range of motion as you go through therapy. So if you'll just scoot all the way back so your ankles are just hanging off the table here. Just relax.
Okay.
Alright, I'm going to place the axis of my goniometer between these two big bony points here. These are your medial and lateral malleolus. And I'm going to put it right in between. My stationary arm is going to be parallel to the tibia, and my movable arm is parallel to the second metatarsal, or your second little piggy down here. Okay, so we're going to do what's called an inversion, and that's bringing your foot in like this. Okay? And I don't want you to have any pain or cramping. If you do, please tell me and we'll stop immediately, okay?
Okay.
Right, ready? 1, 2, 3, go. And relax. Relax. And I've got you at about 37 degrees. And now we're going to do eversion, which is to pull it out this way, okay? And I'm going to use the same points in between your medial and lateral malleolus, parallel to your tibia, and parallel to your second metatarsal or your second toe there. And go ahead and bring it out. Okay, and relax. And I've got you at about 28 degrees. Okay, now we're going to switch over to this side, and I'm going to put my axis right in between your medial and lateral malleolus. Stationary arm is going to be parallel to the tibia. Movable arm is parallel to the second metatarsal, and we're going to invert, pull that foot in. Very nice, a lot of motion there. You're at about 55 degrees, and relax. And now we're going to go ahead and pull it out to eversion. Whew. And you are at about 33 degrees. Very good. No pain, cramping, everything was good? Awesome. Okay, now we're going to do a manual muscle test. And essentially, that's just going to tell me the strength of your muscle. I'm going to give you a grade of a 1 through 5. Now I'm going to have you scoot down so that way your leg is hanging off.
Okay.
And I'm going to put this sheet underneath just to kind of make it a little more comfortable and make your leg in a bit more of a 90-degree angle here.
Okay.
Okay, and I'm going to use this stool to support your non-test side. So go ahead and put your foot up there. And we are going to bring your foot out, invert your foot, and I'm going to try and push you back this way. Don't let me, okay? And I'm going to count to 3. So go ahead and bring it in. And 1, 2, 3. Relax. All right. And now we're going to try the other side. You're going to pull it out, and I'm going to try and push it back in, okay? And 1, 2, 3. Relax. You were able to do this side against maximum resistance. Now we're going to switch and check the other side.
Okay.
Okay, so we're going to move the stool over. Here we go. And we're going to place this underneath. And relax. Okay, so I am supporting and stabilizing. And bring it in. And now I'm going to try and push it out. Okay. So that's 1, 2, 3. Very good. Pull it into eversion here. And 1, 2, 3, relax. Very good. So both sides you were able to hold against maximum resistance, so that's a 5 on each side. We were testing your inverters and everters. So those inverters, it's going to be like your tibialis anterior. You can kind of feel it running through here. And then your everters run along the side here. These are going to be your fibularis longus and fibularis brevis. They're going to pull that foot out, so that's what we were testing there. Do you have any questions, comments, concerns for me?
Nope.
All right, well, I will make notes of everything and send that off to the therapist, and I hope the rest of your therapy goes well.